During my tenure as the global medical leader at General Electric, we were required as all leaders of all departments of the organization to have a continuously evaluated and improving multi-year strategic plan. And so as my company HealthNEXT has studied benchmark culture of health companies, one of the hallmarks is that they know what they're doing as it relates to health and well-being in 2025. I mean, they know what they're going to do this year, they know what they're going to do next year, and they know what they're going to do at least 3 years out. And the reason for that, as Mark commented, is that building a culture takes time, and markedly impacting the illness burden and health of a population takes time. And what we have found with benchmark culture of health and well-being companies that have a multi-year strategic plan that reaches employees across the population health and well-being continuum is that first you see that the illness burden and aggregate risk of the population covered and the workforce stabilizes and stops going up. We know from research done from my mentor and great friend who I miss very much because he's recently passed away, Dee Eddington's research out of the University of Michigan shows that populations generally get 2 to 4% sicker every year if you're not doing anything. And that is a major contributor to our first fact, which is this relentless escalation of healthcare costs. If we don't do everything we can to stem that tide, a shame on us. Ultimately, even economists believe that this can be a tremendous threat to American enterprise as Americans get worse. Each generation, they get there's more chronic illness, and over the years, they're getting sicker at a rate that we can mitigate. And so the first thing that happens when you start to build a culture of health and well-being in a corporation is you start to see that chronic illness prevalence stabilizes before it goes down, and aggregate risks, health risks, also stabilizes before they go down. But it's a day to celebrate when employers can demonstrate that their workforce is no more ill in 2023 than it was in 2022. And it is possible. And one of the ways that it's possible is by developing a thoughtful multi-year strategic plan.